Good afternoon, everyone. First of all, I would like to thank UITM Private Specialist Center for giving me this opportunity to share with all of you about CT cardiac calcium scoring screening. So, as in most parts of the world, in Malaysia, the #1 killer disease is heart disease. So that is why it is very important for us to know where our heart health stands. And studies have shown that 62% of males and 42% of women with coronary heart disease usually present as sudden death or with acute myocardial infarction. And this is very disturbing because most of these patients are at their peak. That means they are at an age where they're contributing to society and to their family. So they're not only a economic burden to the country, but it is a toll for the family because they might be the sole breadwinner. So here in UITM, aside from teaching medical students and other students, having clinical services both in the government side and in the private sector, in the medical imaging unit, we also have a state-of-art CT scan. And this CT scan machine offers a very pertinent test for detecting heart disease, and that is the calcium score. Now, a lot of time when patients go and visit their doctors and to see their doctors, they would like to know what is going on inside the body, and they would like to have the doctor predict what is going to happen to them. So this is where the role of CT scan is very important when it comes to coronary heart disease. And the amount of calcium present in the coronary arteries is a very helpful indicator in preventing disease and also reducing, most importantly, death by heart attack. So let us talk a bit about the pathology of the heart disease and the anatomy of the heart disease. And it all started back during the Renaissance period, whereby the Renaissance European pathologists, when they did their post-mortem, they noted that a lot of their patients with heart disease had some form of calcification within the coronary arteries. So for those of you who are wondering what coronary arteries are, let me explain a bit. This is the heart, and the main function of the heart is to supply blood to the rest of the body. It also receives deoxygenated blood. It then gets circulated through the lungs and into the heart, and it pumps out to the rest of the body. And this blood supply is crucial, and it also provides nutrition to our cells via arteries. So this is why it is very important to maintain a good function of the heart muscle. And the heart muscles are supplied by what we call coronary arteries. And there are many coronary arteries. There's on the right side and the left side. Left side is further divided. This is why sometimes you will have your family members or your friends coming and saying, I have 1 vessel disease, I have 2 vessel disease, I have 3 vessel disease, I have 4 vessel disease. We don't want to go that far, okay? So, so this is the coronary arteries that we want to make sure that we do not do anything to hinder the blood flow within it. A normal coronary artery, as we see in the image above, is supposed to be pristine. It is clear. There is nothing in the walls except what God has already intended. And there is supposed to be a clear blood flow so that it will provide proper nutrition and oxygen to the heart muscles. Now in picture B, with our food intake, our different risk factors, our lifestyle, what happens is cholesterol can build up in the walls of these normal arteries. And it will gradually build up, and we have here in the first picture a normal coronary artery. This is how it should look. It's almost like your water taps. It's supposed to be clean, and this is the wall of the coronary artery. It starts as a fatty streak slowly, and then it gradually develops, and it causes narrowing and probably even to a stage of obstruction. So there you can have, like I told you before, one vessel disease, two vessel disease, multiple diseases, and at the same time you can also have different percentage of blocks. You can have 30% blocks, you can have 99% blocks, and the same vessel, sometimes you can have multiple blocks in the same vessel. So the coronary artery disease is the progression. All this is what we call a plaque, all right? And the plaque gradually builds up, and we call it atherosclerosis. Atherosclerosis simply means hardening of the arteries. So once the arteries become hard, they stiffen and they are unable to perform as it is supposed to. And you might be wondering how calcium comes into the picture, because we call it calcium scoring. And calcium is part of the inflammatory and the repair process of this atherosclerosis, and this is how we pick up the calcium on the CT scan. So the progression of plaque build up in the coronary artery can be seen in three ways. It can be narrowing the arteries, and this is when some patients come in with pain. The pain can either be in the chest, the neck, the upper arm, especially when you exercise. And for those of you who have heard the word angina, this is what it is, when the vessels get narrowed and the blood flow to that particular area is reduced. And then another way of presenting is there will be complete close off. So this can either present as death or acute myocardial infarction. And the third way is where it can rupture suddenly and release materials to the rest of the arteries, and thereby blocking the flow. So this is just diagrammatic picture of showing a normal vessel with blood flow. There is some amount of obstruction here. These are the blood cells. There is, as you can see, there's a reduction in the flow beyond where the block is. And in the third, there is a complete block, and this part might dislodge and go further down and cause other blocks too. So in doing a CT scan, what happens is the calcium pops up, and we can see the calcium. And this is an example of a normal patient. This is a normal blood vessel. This is what the normal blood vessel looks like, and this is also, all these are normal blood vessels. When you do a calcium score, what happens, if you have calcium within your vessels, this is what it will look like. It will come out as white. And we do not give any contrast, so the white is quite prominent. Of course, it depends also on the degree of the whiteness, and we have a way of measuring it. So the aim is to detect your plaque early, and they have compared the different types of obstruction. As I told you earlier, you can get different degrees of obstruction, starting from, normally we start calculating from about 20 degrees right until total occlusion. And these patients may or may not present with symptoms. Symptoms are what usually the patients come in with. For example, you can come in saying that you have a chest pain or you have a neck pain. This is considered as symptoms. And then the doctor will suggest for you to do either a stress test or a cardiac CT scan. So in this here, the stress test is not your the normal exercise stress test. It is more of a nuclear study stress test, and it has been found that in the early stage, the obstruction, whereby the obstruction is none, the symptoms will be none, the stress test will be normal, and the cardiac CT scan won't pick up anything. And then you come, this is the diagram of what the calcium, this is what we pick up on the CT scan. Then you have the moderate stage, which is approximately about 20 to 50%. Again, the symptoms can be none, the stress test can be normal, and this is where we pick up the abnormal CT scan. So this is where we want to pick up the plaques, because we want to prevent it from progressing and causing any worse symptoms. In the advanced stage, where it is 50 to 70%, again, you might not have any symptoms. The stress test can be normal, but we will be picking picking it up on the cardiac CT. And of course, the patient will come in with symptoms and there will be obstruction. So why do a CT scan? First of all, it's a very simple test. You do not have to prepare for it. When you go and see the doctor for a cardiac CT scan, we do advise you not to smoke beforehand and not to consume coffee, only because we do not want your heart rate to go up, because it's just like taking pictures, it's just like a camera. When we acquire the images, we need a heart. We can't make the heart still because then that will cause death, but we do want to reduce the heart rate, okay? So it's a very simple test. There is no prior preparation. The whole test takes about 3 minutes from the time you change your clothes, you go in there. The scans itself only takes 30 seconds. So this is why I feel 30 seconds can save your life, okay? And we do not use contrast, unless, of course, it is indicated by the cardiologist, whereby you want to see the level of occlusion depending on your condition, then only we do a contrast study. Otherwise, if it's just a plain calcium scoring, we do not use contrast. And the radiation is very low. I'm not promoting any machines here, but the machine that we have here in UITM, the radiation dose is much lower than a lot of machines out there. And because the calcium is a marker of the coronary artery disease, the amount of calcium detected can give you some form of prognosis. So the doctor can advise you how to go about not only medical therapy, but also your diet and your exercise to prevent it from disease progression. So the goal of the cardiac CT is to determine whether or not you have coronary artery disease, and if present, to what extent. As you know, we are calculating plaque burden. This is done by the machine. There is a way we calculate it. We can tell you what is the percentage of your plaque burden, and it is now recommended by a lot of physicians, and a lot of times we don't do it for every patient. A lot of times we look at your risk factors too. We look at your age group. We do not do for very young patients because we do not catch the calcium, and we do not want you to be exposed to unnecessary radiation. So we take into consideration your age, we take into consideration your risk factors. And when we are talking about risk factors, we're talking about cholesterol levels, we're talking about family history, diabetes, blood pressure, cigarettes. Cigarettes is a contributing factor. Of course, physical inactivity and overweight also. So I just want to show you how the scan is roughly done. This is what the CT machine looks like. It has got what you call a donut space in between. For those of you who have got claustrophobia, don't worry, because both sides are open, and the patient just goes through this and we acquire the images. And this is what we pick up. This is a normal blood vessel, and these are the calcium deposits, or what we call atherosclerosis disease, in the wall, and we calculate it. In this patient, he's got calcification in all the 3 vessels. So this is a 3-vessel block. Calcium score, we do not give contrast, but if we do give contrast, we can tell you what kind of occlusion you have. And also the severity of the calcium deposit is categorized into minimal, moderate, and severe. And this is what I mean by a calcium score. It's supposed to be a 0, and then if you have from 1 to 10, it becomes minimal. And the highest score that we take is 400. If you have a score of 400 or more, we give you a different set of advice, and we do not proceed or do any contrast study. So whatever you do, you have to see a doctor, preferably a cardiologist. The cardiologist will then recommend and see whether you fall into a category of doing this calcium scan or not. It is not advisable for everybody to do it, so you must see a doctor before, and you must have a recommendation from the doctor when we do this scan, because it does involve a small amount of radiation, a very safe amount of radiation. All right, thank you all.